As of the 5th of March, we had confirmed and verified 117 cases of COVID-19 infection in Singapore. Of these 117 cases, 81 have fully recovered from their illness and have been discharged. 36 still remain in the hospital, of which 7 remain in the ICU and are critically ill. Our doctors and nurses continue to do their best and give appropriate care for these individuals, and they are committed to doing their utmost for them. Our doctors, staff and nurses and the entire healthcare team continue with epidemiological investigations and contact tracing. And this aims to identify close contacts for these cases and to understand better how the virus spreads in Singapore. When our contact tracers identify close contacts, they will check on the health of these contacts and, if needed, refer them to a hospital for further assessment. They will take measures to isolate these close contacts. If necessary, quarantine orders are used, and will keep the contacts under close surveillance. And it's important for all close contacts to cooperate with our health officers. It's important for the information of their whereabouts, their movements to be made known, and we believe by continuing to isolate confirmed cases of COVID-19 infections and to ring-fence these close contacts, this will be and continue to be an important strategy for us to limit the spread of COVID-19 in Singapore. This, therefore, requires all of us to be socially responsible. If you're sick, please don't continue your social activities or go to work. This makes the difference between individual cases coming up for our health system then to identify them, to treat them, and a cluster that comes up because of people who are unwell, still continuing with their social activities and going to work. If you're sick, go to see a doctor as soon as possible and stop your social activities or work activities. Follow the doctor's instructions to rest at home. Respect the MC that he issues to you and go back to see the same doctor if you're unwell. Being socially responsible helps to protect our community. It will not prevent more cases from coming. We remain vigilant about the importation of cases, and it's not just cases where we know there are high numbers of cases in those countries, but in countries where at this point in time the threat of COVID-19 still remains to be fully elucidated. And that threat occurs because we are a porous country as an international air hub. Our borders are porous. And the travel restrictions that we put in place are aimed at trying to help us to sense make, but at the same time also to help make the situation in Singapore more controllable. We ask, therefore, that all travellers be cooperative with us. We've started surveillance at our borders, and it's aimed really to make sure that we have an ability now to sense make where cases are coming from into Singapore. And it's important that all who have interactions with our health officers, whether in the context of border surveillance, in contact tracing, in epidemiological investigations, to cooperate and do their best to support us in this fight.